So a big shift from the interesting talk that we just heard. I do research in wireless communication. That's my umbrella field. And what I'm going to be presenting today is brain-computer interface. And you see this Center for Sensory Motor Neural Engineering. The research that I'm going to be talking about is a part of that big center, and more as I speak. Outline of my talk, I'm going to first introduce what that center is about, CSANY, that's what the abbreviation is. My role in that center, my research contributions to the field of brain-computer interface neuroengineering. I have an education contribution too, so I'll discuss that, and where I see this going. And then finally, questions, comments, and thank yous. Okay? So to start, what is CSANY? What is that center? That center is an engineering research center. National Science Foundation funds a few of these, and by few I mean 10 to 11, in any given 5-year time scale. It's a $35 million grant from National Science Foundation for 10 years. So it's a very big thing. It's a big thing to be part of this. This particular Center for Sensory Motor Neural Engineering, San Diego State, University of Washington, and MIT. These 3 universities are a part of this center. And these are what the center focuses on, rather NSF wants us to focus on. So it's definitely research. Spread the research right from K through 12, community college, undergrad, grad. So education is a big component there. Commercialize the research that we are doing. And finally, get ourselves to a point where we can continue with this research when the $35 million disappears. Okay. So with that, where do I fit in the center? So I wear 2 hats. I'm a researcher, a PI, and I'll tell you what my research is about. And then I'm also the education co-director. So the 3 universities that I mentioned, each one of them has an education component and a director at every center. So I'm the education co-director at the SDSU ground. As a researcher, so the first bullet that I have here, helping the body heal, feel, and move again. That's what we are trying to do. In a nutshell, we are trying to bring back mobility to paralyzed limbs, and especially focusing on the upper body, the forelimbs, the arms. Okay? So in order to do that, many things have to happen. I particularly focus on wirelessly transmitting brain signals to the paralyzed limb. Okay? So if the spinal cord is injured, can we bypass the spinal cord and still take the signals to the limbs, thereby restoring mobility to the limbs? So in layman terminology, that's what we are trying to do here. And my team comprises of myself, my graduate students. I have 1 PhD student right now, 3 master's students who are doing their theses on this under me. Over the period of 7 years that I've been with this, so I've been with the center ever since its inception in 2011. I've had 2 postdoc researchers and other visiting faculties who have come and spent time with me on this project. I'll talk about the education in a bit. So talking about my research contribution to this, let me first explain a few terms here. So I've been talking about neural engineering, I've been talking about brain-computer interface. So what exactly is brain-computer interface? It's a direct communication pathway between the brain and an external device. So what we mean by that is, if I am staring at a cursor on a computer screen, I'm doing nothing. In my mind, I'm thinking I want the cursor to move right. And the cursor moves right. That is BCI. That is brain-computer interface. So now imagine for a paralyzed person, that's of tremendous importance, right? He's not able to move his limbs. He sits in his wheelchair and he stares at a computer and is able to play a computer game just through his mind. Okay? So that is the power of brain-computer interface. In order to enable something as magical as that, we need the power of neural engineering. And neural engineering is nothing but using engineering techniques to understand, repair, enhance, replace, or otherwise exploit the properties of the nervous system. Okay? So that's that. The name Center for CSANY, Center for Sensory Motor Neural Engineering, what do we mean by sensory motor? The fact that it has both sensory and motor. Sensory in terms of sensing, so I'm sensing, feeling, thinking, and that thought gets translated to action, a motor activity. Okay? So that's what this is about. What you're seeing there is pretty much the essence of the to understand the research that we do. So from the brain, the green arrow, I hope it's visible, the brain generates a signal. The signal passes through the spinal cord, and in this particular case, we are focusing on the upper limb. So there's a particular nerve from the spinal cord which will take the signal to the upper limb. Okay? So for a healthy human being, that's how it works. Now, if for some reason there's a damage in the spinal cord, some accident, what have you, that signal then disappears, as in the signal is still generated, but the pathway is broken. So the signal cannot reach the target body part. Okay? What we are trying to do in the center is, if the signal still exists and is being generated, can we bypass the spinal cord and take the signal through some artificial means, wirelessly here, to the target organ, to the target body part, which is the upper limb here. Okay? So that's what we are trying to accomplish. In order to do that, as I said, there are many things that needs to happen. So what we are showing here is, this is the human brain. We have devices called electrodes. Electrodes which are implanted in the brain picks up these signals. But the electrodes don't have the ability to transmit the signal. They can pick it up from the neurons, but then you need an electronic transmitter to transmit the signal. Before you transmit the signal, these are the kind of things you need to do to that signal. You need to understand what the signal is. You need to, there's something called spike sorting, there's something called signal translation. So a lot of things has to be done to the signal before the signal leaves this human brain and is wirelessly transferred to some external controller. That controller could be the cursor, the example that I just gave you. It could be a prosthetic limb. It could be a muscle stimulator on the paralyzed limb, which receives the signal and then stimulates the muscle, and thereby the arm moves. Okay? So it could be, as I said, any external controller. So this is the part where I come in, the wireless data transmission. So what's the big deal about the wireless data transmission there? So going back to what I just said, there's an electrode put inside the brain through surgical procedure. This electrode, I've kind of magnified this here, picks up the signals from the neuron. Today, if you go on YouTube, you'll see a lot of these magical stories of prosthetic limbs moving by themselves and so on and so forth. So today's technology, you'll not be able to read this. What I'm showing here is the blue is the neuron, the green is the electrode, which is picking up the signal from the neuron. And then today, the cutting edge product that we have today on the market is, this electrode is connected through a wire to a transmitter which sits right beneath the skull. Okay, so it's not implanted deep in the brain. Okay, so it's just sitting right beneath the skull. And this wire carries that neural signal to this transmitter. The transmitter then transmits the signal to a receiver, and the receiver could be, as I said, the external device, which could be a prosthetic limb, which could be a stimulator on the arm. Okay, so if this is done, then what are we trying to do? So what we are trying to do is as follows. We are trying to remove this wire. So why is this wire bad? It has, lots of studies have been done on primates, and it has been shown that this wire causes scar tissue and the animals die. Okay? So this cannot be a permanent solution. This operates for a few weeks, maximum a couple of months, and then it has to be removed. So if we have to really do this for a human being, then we have to remove this wire. If we remove this wire, then this transmitter now has to sit right on top of this electrode. So there's a neuron generating the signal in the brain, the electrode picking that up, passing it to the transmitter. The transmitter now needs to pass it through the human brain to a receiver outside the body. The receiver then transmits it to the target organ. Okay? So this is what we are trying to accomplish. Everything else that you're seeing here are my lab setups of how I mimic the human brain. But let me just focus on the problem at hand without going into those details. The research challenges that we face is first and foremost the choice of the transmitter. You're transmitting something, transmission is power. You don't want to fry up the brain tissue. Okay. So you have to choose a transmitter that's extremely low power, and yet it does the job. The neural signals are a lot of data. So a tiny transmitter with tiny power, yet having the capability to transmit that large amount of data is a challenge. Not just that, the medium. Nobody has ever studied how blood, tissue fluid, tissue, skull, all of this together impacts a signal. So if my brain is generating move your arm to the right, and the signal does not retain its integrity by the time it reaches the receiver, the hand move can move to the left, which is not a desired consequence, right? So retaining that signal integrity, not letting the medium affect the signal, and yet doing all of this in real time, right? My brain thinks and I move, right? I'm moving my arm, it's nanosecond time. Right, so getting all of that going is a challenge. And these are some of the technical results that we are after. What I want to kind of show, I chose to put up just a couple of graphs, but what we kind of found out with the lab setting experiments that we have done, how much time do I have? 2 minutes? Okay, is that an implant depth of 1 to 2 centimeter, we can still accomplish somewhat of what I just said. Okay, any more than that, it really becomes difficult. Okay, moving on, I want to talk a little bit about the education contribution. As I said, NSF is big on taking this to to the high school level and beyond. So this summer we ran a summer camp with high school kids in neuroengineering. We had them wear this device. This device captured their thought. They were supposed to stare at this servo and make the servo rotate. The more they focused, so they had to just wear that device, stare at the servo, and the servo would rotate. The more they focused, the more the servo would rotate. Okay, so that's the project they did. It wasn't magic. They needed to write C code, they needed to put electrical circuits together, and they did. Yeah? And it was something, so when we looked at the surveys, that was really, students had a lot of good things to say. Not just that, we made them do a presentation. So at the end of this 2-week workshop, we made them jot down their thoughts and tell us how they would contribute to this area of neuroengineering. And I was impressed by the ideas that they had come up with. Sounds very, as I said, magical, but the fact that they could think that through and had those ideas was very, very impressive. And we also have projects which engages community college students to come to our university, spend summers in our labs here. I call them internships because these are paid positions that NSF allows us to pay these students just to encourage them to get a feel of what research in neuroengineering looks like. Okay? And that's pretty much it. I think the road ahead, I want to say that there are lots to be done, especially in terms of better collaboration, extensive collaboration with other universities who are doing this kind of work, and we have quite a few of them in California. Berkeley is doing great work in this area. And research and education funding, animal testing, everything that we have done so far is in the lab. We want to take it and really test it on animals to see how our algorithms fare. And that's it.
Other way.
Sarkar, that's wonderful.
Thank you.
I was wondering if you, for example, want to tune in on certain neurotransmitters for specific purposes, is that a way to do it? Because they are deeper and the level is so low, like femtomolar level. So is that a way to go deeper, or are you just looking on the surface more or less?
So right now, what we have with the lab setting environment, we can go up to 2 centimeters, and we are still within the FDA regulation of how much power that the transmitter can use to transmit data. And when we look at the received signal, the signal is still decodable, retains all the integrity. And from what my neuroscientist colleagues at University of Washington tells me, chances are we may not need to go deeper than that for a lot of purposes. So especially for upper limb, the signals are all generated in cerebellum, which is kind of like here. It serves the purpose. Okay, but your question is, 5 years down the road, people have to be looking into that.
So
so you didn't really mention, because it was in your last slide, about the ethical issues around this technology, and my question probably touches upon that. But you're designing your discoveries around recovery of lost functions. What are obvious enhancement or new brain functions that you might be able to introduce into a human population with the same kind of technology? Can you give people ESP? Can you make them start to do things? I mean, what kinds of applications do you see this going forward, and giving addressing the population at large instead of just that population of people who have lost capability?
That's my answer is I don't know, because we have been focusing on, as I said, people who have lost those functionalities. But as of now, that's not the focus. But that would be something interesting to look into as to what.
Courses,
I'll tell you, a lot of neurosignal translation goes into doing what we are trying to do, and by that, so I'm kind of trying to say, with horses, what may or may not be the case is, for a human being, when I move my arm like this, the neurosignal that's generated in my brain, instructing me to move my arm like this, can be slightly different from the signal that your brain generates to move your arm like this. So clubbing all the different kinds of signals that possibly might mean do this, that itself is a challenge. Doing that in humans is still okay, because we can have 100 humans and test that to see how each of their signals are generated. So we can tell them, hey, move your hand like this, and let me see how the signal looks. In order to do that in a horse, that would be difficult, right?
Keeping track of your children, I'm just thinking like,
okay. No, the applications are various. Yeah.
Might apply to the general population as opposed to exclusively those recovering lost function. That's all.
The answer is I haven't thought of that, but there are many, I'm sure.
If I may, my question is somewhat along the same lines. I'm fascinated how it took engineers to demonstrate that there is no psychological phenomenon without biological basis. So you are capitalizing on that to transmit the signal from motor cortex to our muscles. Can we use it not just to bypass spinal cord, but actually to redirect whatever stimulation may be generated in cortex? For example, in the case of Parkinson's disease, can we redirect signals?
Yes.
Or reformulate signals so that we help those who suffer from it?
Yeah, absolutely. That I know for a fact. And that is why the tagline changed from heal, feel, and move again. It was just move. But the fact, when we were doing all of this, we realized that people with Parkinson's disease can be helped through the mechanisms that we are talking about. So, yes.
Just these last two questions. Have you read The Terminal Man? It's an old book. It's early when people started doing brain stimulation. You should read it. It's a science fiction that deals with these issues.
And you're not the first person who has asked me this question. I really have to go back and read it now.
But that really wasn't my question. You really hit on my question in your last slide, and that is the idea that you could make one probe, if you would, that would allow you to do this. But what if you want to make somebody who can do this and this and this and a variety of things? So in essence, it would take a kind of a wraparound type of probe potentially to detect a variety of signals that.
Absolutely, and multiple. And I think my last slide said that right now it's one electrode array capturing recording of a few neurons, and just getting that going itself is becoming is challenging. But what you're saying is, in order for a wholesome mobility, we will need to do that, and we still don't know the answer to that.
What would be the potential vulnerabilities? What would be the potential vulnerabilities to external signals? For example, if I got all wired up, could I be hacked by my dean?
Yes, and as you know, as funny as it sounds, it is true. And patients who are who do not have mobility today are not very, so that is where the neuroethics come in. People are not willing to volunteer. You know, because yes, what you just said is very possible. It's a wireless signal. People can hack into it. And I think, I didn't have the time to go through this. All these red boxes are all the maliciousness that can creep into the system because of exactly what you said. And those are issues to think about. Yeah.
Don't tell the deans when you get it all worked out.
I know. I won't.
Any other question? It is fascinating. You just start reading motor cortex. Imagine when we deep down into amygdala and start reading our emotions in addition to the signals that help us move. It's going to be interesting.
Yeah.
Any other comment or question? Well, thank you very much.
Thank you. Thank you.